Hello, how are you doing, Connie?
Good, how are you doing?
Good, and just adjust the camera a little bit. How's that? Can you hear me okay?
Yeah, all good. Thank you so much for taking time out of your lunch. I know you're incredibly busy with all your various things that you're up to at the moment. For anyone that doesn't know you and doesn't know Total Fertility, can you tell us just a little bit about the work that you do?
Yeah, sure. No, yes. Thank you for inviting me along to this. I think this is a really important subject, and I'm glad that ExSeed are covering it. So I'm a reproductive medicine specialist, a fertility specialist, however you like to sort of describe us, what we do. So we're doctors essentially who specialise in the fertility side of things, both male and female. I'm a consultant in London and Oxford, and about 3 years ago, I set up Total Fertility, which is a website which really is a sort of a rich resource for lots of people that are looking for fertility information, a mixture of things across all different areas. We have a sort of twice monthly podcast. We have clinics that people can go to in the UK, across Europe. So it's really trying to help people understand a bit about the costs of fertility, where to go, and what success rates are. So that's my aside, as well as my day job of spending a lot of time with patients.
And you said that you deal with both men and women. And I think something that's pertinent to the conversation around fertility, but also cancer, is do you see there is a slightly different approach to these things from between men and women? And, I think we hear from a lot of women and men as well, that it's a bit of maybe a head in the sand approach to fertility and health in general with guys sometimes.
Yeah, I mean, it can be. I mean, it's much more common. I think girls are much more used to talking about these types of things, and men are, it's probably not sort of front of the mind all the time. And it's not always true, but there are, it's certainly some sort of, it seems to be more often that men will think of it sort of as a second thought, and think about it when it really only matters. And of course, what we're talking about today is cancer, and of course that suddenly does bring really crystallise things for people in their minds. But yeah, I think there's a huge taboo around fertility for a lot of people, and I've myself, having spent a lot of time with patients, but close friends as well. It's a really hard subject to talk about, and so a lot of people do bury it.
Yeah, 100%, which is why obviously we try and sort of do our part to change the conversation, but podcasts like yours and just, I think, hearing male voices in this space is really important. So thanks for everything that you do.
Yeah, no, I agree.
In terms of, before we maybe get into the link between cancer and fertility, Male Cancer Awareness Week, can we talk a little bit about what we mean when we say male cancers, what those cancers are, and kind of what comes under that bracket?
Well, there's several. I mean, the common ones that sort of spring to mind for fertile young men, of course, is testicular cancer. That's the sort of biggie. But there are other cancers. And of course, with fertility treatments, helping people to have children later and people delaying their families, there are other cancers which you might get in sort of later decades of your life, but actually can affect men earlier on as well. And prostate cancer is one of those. Cancers of the penis and things like that are much rarer, and we're less likely to see those. But we mustn't also forget the other kind of wider group of cancers as well, the sort of the systemic cancers, because of course they can also have an impact on your fertility. And I think that's the broad picture of you. Yes, men are affected by all types of cancers, as are women, and it's the sort of impact on your fertility that any cancer could have. So it may not just be a cancer of an organ of the reproductive system, which is the problem directly. It could be a blood cancer. Commonly lymphoma is one that can affect young people and young men. And so it's really quite a broad subject, and it's really trying to understand the impact it has and what can be done.
Yeah. It's really interesting you mentioned lymphoma, because actually I have a very good friend of ours who's 29 actually. When he was living abroad, he found a lump and he happened to come home because of lockdown, and his mum went, "You need to get that checked out," and it was lymphoma. And he said himself, had he not come back, he wouldn't have noticed that as a sign. He probably wouldn't have been concerned, and he probably wouldn't have done anything about it. And he's gone through treatment and is in remission now, which is great. But I think the story can be really different if we aren't aware of the signs and aren't listening to our bodies, and kind of
it's that whole wide, I think you're right, Connie. I think it's that whole wide awareness that we need to kind of really get people thinking about, because mostly as a child you spend most of your time being told not to create pregnancies, and then it's as you get older that sort of begins to function. But when you're in your 20s and your 30s, you're working, often enjoying life, you have disposable income, we go off and do other things. It's really put to the back of our minds, but these are the types of years where things can affect you, people do find out that they have diagnosis which can impact on fertility, and it can be a real shock. And actually the stress that it involves, for people that come through the clinic who have been suddenly given a diagnosis, it can be incredibly stressful and very emotional for men. A lot, being a proud male, you sort of expect, hopefully, as many of us do, that you'll be able to perhaps have a family, and then suddenly that can absolutely be taken away from you, and you have some really big decisions to be making. So I think this is a really important thing, not just to talk about the specifics of cancer and its impact, but also just to increase awareness around general health, because that can lead to ultimately being healthier and giving yourself a better chance in the long run.
100%. And I think you're right. I think that, a cancer diagnosis of any type of cancer at any stage of life is obviously, it just turns your world upside down. But I think that if you are going and you're like a young guy and you get this cancer diagnosis, and then suddenly it's like, oh, and by the way, we now need to talk about your fertility, and you might not have thought about any of these things. It's so much to like process emotionally and mentally and just practically. And I think it's really great if people start to have these conversations before they're impacted by it, so actually they have some idea of what that might look like.
Absolutely. I mean, I think the closest I can say it's like to is being, as a man, told that you don't have sperm in the ejaculate. And I think it's important today to talk about, where does sperm come from, to talk about the very basics and understand what is the ejaculate, how does it all function, and we'll probably get onto that. But yeah, certainly the men that I've met who are suddenly told there are no sperm there, it's a real sort of punch in the stomach, and it's a huge thing to come to terms with. It takes a while. The problem with an oncology diagnosis, of course, is you often haven't got a long time to come to terms with things, and you have to do things fairly quickly. And of course, what we're talking about as well is creating an insurance policy for patients to be able to hopefully preserve their fertility when you do have an oncology diagnosis, so a cancer diagnosis. So yeah, there's a lot of information that patients have to take in very quickly and process. And I think the oncologists are expert at that. I mean, over the years of doing this, I've certainly seen that's the support that patients get, and the speed at which things happen, I've always been quite impressed by. But yes, it's important that we don't just talk about the direct male cancers, although they are important. Had some very close dear friends. In fact, we've done some stuff on Tota fertility with some quite well-known people who've had testicular cancer in the sporting world. And it's incredible talking to those super confident, outgoing people, just how much of a shock it can be. So it's a really important area to be tackling in this week.
So in terms of, and I think this is really important kind of to talk about and you're the best person, you're a medical professional, so amazing person to ask. Cancer, can cancer cause infertility, or is it the treatment? And I think, and I guess if there's testicular cancer and you lose a testicle, then that might impact your infertility. So it'd be really good to know a little bit more about how, like you said, how the sperm is produced and how cancer and the treatment can impact it. Yeah,
it's a really, really good question. So, I mean, so men, we're sort of like factories of sperm. So we're producing sperm all the time. We make it every day of the week. Sometimes we do it well, sometimes we don't. And essentially the body's always turning sperm over. In the difference and the contrast, of course, is that girls have all their eggs when they're born and they use them up through their fertile life. With the sperm production side of things, then things do have the ability, therefore, to continue to be produced. That what happens is that the brain will obviously release hormones, the testicles release hormones, and it's those hormones that are responsible for sperm production. Now, sperm require ejaculation, they require erection, penetrative intercourse, and ejaculation to happen. Now, all those things need to function for the system to work, and through sex, you'll obviously hopefully achieve naturally. But if any of those systems are not working, or maybe damaged by either cancer or treatment, then you can see where there can be a break in the loop and the process can fall down. So this can affect men in lots of different ways, depending on the cancer, depending on the treatment. The obvious one, as you just said there, is testicular cancer. As a man, it's very, very important to check the testicles, have a feel of the testicles. In fact, the easiest way to check the testicles, if you do have a partner, is to ask your wife to check a testicle, because actually they're more likely to notice a lump or a bump than you are.
Yeah.
And actually, men do it. It should be checking the testicles in the shower. We don't talk about it. It's not the easiest thing to discuss, but it's such an important thing. Having any symptoms, aches, pains, swellings in that area, it's so important to get advice and be sure.
It's just good to know what's going on down there. I think be more in touch with our bodies, because it might be a cyst, it might be this, and then we have conversations that it's not cancer but something that might impact your fertility, like varicocele, or these sorts of things, if men aren't familiar with their bodies, then it's hard for them to notice those changes. So I think even with not talking about cancer, it's really good to just know what's going on down there.
Absolutely. And male cancer, so testicular cancer is the one that's, you know, obviously is fertility ending, is having to have a testicle removed. It's usually unilateral in the majority of cases, but you can cause scarring when you have surgery to remove a testicle, and that can therefore cause blockages with the ejaculation process. So men that have a testicle removed surgically will often come through the clinic to bank sperm. They'll often have spotted a lump and then been told that there's a tumour in the testicle, and they're advised to back up sperm. And that usually involves just coming into a clinic, meeting with a doctor or a specialist nurse, and looking at the process of what happens. And that involves, actually, we're quite a regulated industry, as you'll know. Fertility is not something that you can just do down your GP surgery. You can do a GP sort of sperm sample, but once you get into the process of fertility preservation, it has to be happening, certainly in the UK, in a licensed clinic. We're licensed by the HFEA. Every licensed clinic can therefore do this type of fertility preservation treatment. And the one that's been around for the longest is sperm preservation. And that involves seeing a medical professional in the clinic. Usually these things happen quite quickly. So often they can all happen on the same day. So a patient may not have very long between seeing a doctor and actually having to give a sperm sample. And in fact, a dear friend of mine sort of recollects quite amusingly how he was sort of running around on the morning of his operation when he was due to have a testicle removed to try and find a sperm clinic, a fertility clinic that was open to do this. So it can be quite stressful. But essentially what needs to happen with anybody storing eggs, sperm or embryos in a fertility centre is you do need to have some baseline blood tests taken to ensure that you don't carry any common infections like HIV or hepatitis B or C. That's not to say that if you have those infections, you can't store sperm. It just needs to be stored in a separate container. And the sperm is stored usually, if you're doing a fresh ejaculate sample, it's frozen into little straws, and those straws are then frozen in liquid nitrogen, and we call that cryopreservation. Now, normally any man doing this can freeze for 10 years, but if you're having fertility ending treatment, it can be for up to 55 years, which is very topical at the moment.
Yeah, I think
as you
that
know.
was a really important definition, because I think people don't always know that, and actually, that rule is great for other things, but for cancer patients or, you know, for other illnesses that cause infertility, it's always been that way, hasn't it?
Absolutely.
Not always.
And the other thing to say about this, of course, is who's going to pay for it? And most people get stressed by the costs of fertility treatment. It's widely known fertility treatment is not inexpensive. And actually most cancer diagnoses that require preservation of fertility are funded by your local clinical commissioning group. And there are different ones across the UK. But your GP or your oncologist will very quickly be able to access that. But patients coming into our clinic, we'll see them very, very quickly, and we'll get on with the process of doing that. We don't have to wait for paperwork to be filled in, so that patient can be put at ease and can get on with fertility preservation very quickly. But yes, it's very topical at the moment, whether in fact we should be extending storage for patients beyond just the 10 years. And that's a whole different podcast, a whole different... Instagram Live, you know, there's lots of issues there that are relevant. But yeah, so getting back to this, it's not something you should be afraid of. But the easiest thing I can say is it's coming into a clinic maybe 2 or 3 times over a period of a week, producing a sample and doing that. It takes 20 minutes to come into the clinic, fill out the paperwork. All of your consents are completed with the nurses, and then your job is done. And then you can go away safe in the knowledge that you've got that insurance policy there.
And I think, you know, in terms of, like you said, the treatment, so, you know, we talked there about having a testicle removed, which is a very kind of obvious one. And actually one question on that, because I think it's important to ask the questions that sometimes might feel a bit silly. If you have one testicle removed, you can still get your partner pregnant with the one working testicle, right?
Absolutely.
You're still producing sperm there.
I have a friend who's got 4 children following exactly these steps. So it is, I mean, the worry, of course, is will you have a tumour in the other testicle, which is why the preservation process is advised, but also will you have blockages, will you have scarring, will the surgery create a problem, and actually you might end up having to have both removed. You know, surgery does have complications. We talk to patients about this all the time with removal of fibroids, you know, the risk of a hysterectomy, losing your womb during the surgery. So you have to think big picture with these things, and it's really creating that insurance policy. But
Yeah.
you're right, this is a sort of direct intervention surgery to remove a testicle. That's the common one which we talk about. But actually, there's other things as well. And I think
I was going to say, like chemo and radiotherapy. How do they impact things?
So if you think about the processes we've said already of how sperm is produced, interrupting that loop at any point will have an impact. Now, there are many different types of cancer diagnosis and many types of chemotherapy that patients may need to use. And what we would generally, and oncologists are very aware in young patients of fertility, there are different drugs used. Sometimes you need to use combinations of drugs, so not just one, you might use 2 or 3. And we worry more about 2 or 3 different therapies sometimes having more of a detrimental impact on fertility than others. And then there's also the dose. How much do you need and how long do you need it for? And do you need chemotherapy more than once? And all of these things will factor in, as well as your age as well. We haven't even discussed pre-puberty at this stage. We're still talking about adult males that are producing sperm. But you have that concern of damage, toxic damage to the cells that are producing sperm in the testicles, and whether that's temporary or permanent. And this is why fertility preservation is undertaken in a lot of men with a cancer diagnosis who may be facing, certainly either surgery to remove a testicle or certainly chemotherapy. The other sort of treatments we must think about as well as radiotherapy. Some people require radiotherapy. Now, as I said, the hormones in the pituitary gland in the brain tell the testes to sort of begin the manufacturing of sperm. And if that process, that loop doesn't work, then of course the whole system breaks down. So you can find that radiotherapy to the brain for cancers of the brain, for example, can knock out the important hormone factory that's driving sperm production. So there's different treatments for different cancers in different places. And it isn't just about losing a testicle, as you say. It's much broader than that. And if anybody is concerned about their fertility when they do have a diagnosis of cancer, it's always important to raise it with their oncologist so that they can look at things like fertility preservation if they're required.
Yeah, and I think, like you said, it's and I imagine it's the same, correct me if I'm wrong, with the chemos and the radiotherapies, that much like having one testicle, like I suppose there's a chance that you will still be able to conceive naturally, but it's that insurance policy. It's about saying, we need to focus on saving your life essentially right now. So let's preserve that, and then we can do what we have to do. And your fertility might still be there after, or it might not, but you've got that insurance policy that means you'll be able to have biological children if you want to in the future, which I think is the main message. But I think some people might kind of, I don't know. I mean, do you ever hear of people deciding not to go down the preservation route and kind of say, no, like I'll risk it? I mean, I can't imagine most people would, but I imagine it might happen.
I think the oncologists are probably better placed to answer that one, because of course we see the patients that will come through the clinic and we discuss it with. I'm sure there are some, and I think it's very difficult. I mean, sort of some of the diagnoses of cancer that we're talking about here are when patients are very young. And I mean, that's the other issue here. Obviously, the body produces sperm after puberty begins.
We want to ask you about that. If it's children or prepubescent guys,
if you're 10 years old and you have a brain tumor that's going to destroy the process, now you're getting into more experimental things, and certainly Edinburgh is the centre of excellence for this really globally as well. They're doing a lot of research around whether you can harvest tissue in prepubescent boys and then grow those on to create sperm, and there's a lot of work being done by Evelyn Telfer's group and that in Edinburgh looking at that. But yes, if you are already in puberty, then there's a high possibility you're producing sperm. But it's quite an embarrassing thing at a young age to have to come into a clinic, meet people that are growing up and much older than you, and potentially have to masturbate into a pot to create a sample. It must be hugely stressful and a lot of pressure, because as a 14-year-old, I certainly wasn't thinking about whether I wanted to have children. And it's a really, really hard thing to deal with, but needs a lot of parental support and guidance. And I think clinics recognise that, as do the oncology team, when these patients do come to see us.
You said as well, you're often seeing these patients who have maybe gone through that preservation process, and then coming to you, maybe say, right, I'm ready to start a family. What does that process look like? So obviously the NHS essentially fund the preservation. Do they fund treatment, or is that slightly different? And what's that next step? So you're ready to start.
It's really interesting. It's really interesting step and question that. Sorry, and important, because yes, a lot of commissioning groups will fund fertility preservation treatment, but it's not always possible for fertility treatment, which you may then go on to require, to be funded. And that could be for a number of reasons. There's a limited pot of money in the NHS, and there's lots of conditions that need to be treated, whether it's heart disease, vascular disease, lung disease. And the clinical commissioning groups around the UK have to decide where that money goes. And there are limited resources. Now, if you're not conceiving, and you have no sperm, then you can't get pregnant, and therefore you will, as long as you fit the criteria, be entitled to some funding, moving away from cancer now. Yeah. If your sperm has been affected a bit, but actually you could conceive, but it's not necessarily working for you, you don't instantly get funding, actually. And this has happened a few times, and you have to do something called what's called exceptional funding approval, and often this isn't given actually by the NHS, and patients will be in a situation where they need to fund their own fertility treatment. So just to be clear, the sperm which people might preserve, because this is the commonest preservation that we do, they may come back 5, 6, 7 years later. This doesn't impact on the quality, how long it's frozen for, and the sperm will then need to be thawed and introduced into an IVF cycle. And an IVF cycle, if you're self-funding it, ranges from anywhere between sort of £3,000 to sort of £5,000 across the UK, and actually you've also got your medication on top of that. So the costs of IVF can be high. If you are eligible as a couple, if you don't have any sperm in the ejaculate, you've had cancer treatment, and you're eligible and you fit all the criteria, you may, as a man and a couple who, as any azoospermic male might be, a man with no sperm, you may be eligible, but it's not guaranteed. Yeah. So there are different steps to this, in the same way with women that freeze their eggs, or girls that decide to freeze their eggs have to understand freezing the eggs is one step, but actually you've also got the next part of it, which is actually using the eggs. And there's a cost involved at both stages.
Totally. And I think it's, like you said, I mean, and again, I think this could be another conversation around, the IVF postcode lottery and, all of the different decision-making journeys that there are to find out whether you can get funding or not. But I think, like you said, if you're azoospermic, then I guess that's different, and that's whether that's just a medical condition that you have, or if that's been brought on by cancer and its treatment. But like you said, I think again that's why that preservation is so important, isn't it? Because it buys you some time and some thinking space to get your head around that next step without having to make some rushed decisions. Like, your sperm is there, it's not going anywhere for 55 years. You can research it when you're ready.
Absolutely. And of course, people tend to, in their 20s and 30s, want to start a family, and it's not unusual that we'll be seeing patients coming back. I saw a patient just in the last month who's coming back to use sperm frozen some 7 or 8 years ago, and it wasn't from one of the cancers we've spoken about today. So there are lots of causes of cancer, and we're seeing patients coming back to use that sperm, but the only way that they can use it is in an IVF cycle, because the actual process of the treatments we've just spoken about have caused problems, or have they? That's the other thing. Men can have problems with male factor fertility, can be a problem at any point, and it's one of the things that ExSeed spend a lot of time doing, is looking at the quality of sperm parameters for men. Is that a man can have poor sperm anyhow as you get older, which might not allow you to conceive. So this is where it gets quite difficult, and this is where applying for funding can be challenging. But essentially, we do see these people come back. It's usually quite nice, because the sperm has been frozen when they're young, when they're in good health. And it gives them a good chance and a good prognosis. When they do go through that process, we'll guide them through every step. When I see patients in London, Oxford, we will help them with what's involved. There's specialist nurses in the clinic. We also have a lot of fertility trained counsellors who are there, because it can be a huge step to come back into a clinic after a cancer diagnosis and to consider the next steps. I think that's really important, that mental health support that's required for patients. And then I mean, I think the difficulty, which I don't see so much nowadays, is patients who didn't understand about freezing of sperm or didn't understand about fertility preservation. And I have seen them in my career where it just wasn't discussed, sadly. And I think that's something that's changed massively in the last 10 years. And there's really quite heightened awareness about it, thanks to things like this, but also, just wider understanding from oncology and other specialties about male fertility.
Yeah. And I think that was one of my kind of other questions was, if you have someone that, like you said, for whatever reason hasn't preserved their sperm, or maybe, like you said, someone who's much younger and the technology just wasn't there at the time or isn't quite there yet to do that. What are those options for those guys? If like you said, you just basically, even you just you don't have any sperm, you know IVF isn't an option. What are the options out there for guys that are in that situation for whatever reason?
Well, of course, the important thing whenever you're looking at assuming this is a same-sex couple, or sorry, a heterosexual couple, but assuming the relationship is that way, you would look at the female partner primarily as well to check there's no issues there. It's really important not to just focus entirely on the male where you presume the issue is, and you've got to look at the whole picture, ensuring that the female partner, if we take that scenario, has got eggs, that her fallopian tubes are working, there's no structural issues with the reproductive organs, because then you can be absolutely sure of what the best treatment is. Now, a man that's not producing sperm would generally have to have a conversation with a specialist about the use of donor sperm, and we would be going down that route with most young men that haven't preserved fertility or have no sperm.
Right.
But there are also the options of trying to see whether you can surgically recover sperm. Now, if a man isn't producing sperm, let's take the scenario of having had a testicle removed. You may have some scarring in and around the testis. That means that the other testicle isn't able to ejaculate and produce sperm, but it's actually producing it. So if that is the case, you can actually take a man to theatre, pop him to sleep, and you can put a needle into the testicle itself to try and recover the sperm. It's something that's done across fertility clinics. More and more now in the NHS, it's being done by urologists, of course, but I did 3 of these last week, and actually what we're doing is we're trying to directly either aspirate sperm and the fluid from the testicle, which will contain hundreds of sperm, or to take the actual tissue itself. Using a little needle, we can do that quite quickly. You'll be completely unaware, you're asleep, you'll be sedated, and it has pretty good success rates with low risk. And low complications. So this is another technique, but to do that, you need to know the testicles are of a normal size. You need to know that the hormone systems are working fully. If there's a problem at any point there may not be sperm, and you wouldn't want to put a man through a surgical procedure unless you have you're fairly confident that you're going to get sperm. And sadly, we have to give some men the bad news after that procedure that there isn't sperm, and they may move on to donation. So I think it depends on the specific problem as to how we can then move forwards. But it would either be attempting a surgical recovery of sperm from the testicle, or going down the route of using a donor.
We're looking at donors, and I think more and more as the fertility conversation is widening, we're hearing from so many people, both parents and children, who've gone through that donor process, and actually it's a wonderful way to build a family. It might get a little bit of getting your head around, but there's so many happy families out there thanks to that process, so it's incredible. Absolutely.
And there are many sperm banks across the UK and the world where patients can very easily find a match once they've come to terms with the fact that donation is what they require, and they're supported through counselling to make the right decisions. And actually, often patients where the sperm is the prime issue, so male factor, patient may have had cancer and may not be producing sperm, has to use a donor. You don't need to go through a complicated IVF cycle always. You can do insemination treatments, which is very much cheaper and it does have lower success rates than IVF, of course, but actually can work just as well. And we do the vast majority of insemination treatments that we do. An insemination treatment is essentially where you follow a woman through her cycle to where she ovulates, tracking that with her hormones and through ultrasound scans. And then insemination, placing sperm inside the womb at the right point when ovulation has taken place to allow fertilization to take place. Now, that normally carries around about a 15% success rate in most clinics. And that treatment is very much cheaper, less invasive. And some couples will start with that as their prime option. So I think it's a really interesting and wide area, and lots of different treatments that men might either go through on that journey. But when you come to the end of line, or the point of trying to start a family, if you've been through a cancer diagnosis, really important to get a specialist opinion on the next steps for you. But also, any man that's been given a diagnosis of cancer, don't forget your fertility, because it's really important not to forget it, because it's that regret which is really hard. I find when I do see patients that have had that, not had that discussion, not preserved sperm, where it can be very hard for men.
One question we've been talking, I was really interested in terms of sperm testing. Now, obviously, that's what we do here at ExSeed at home,
Yeah.
where people can kind of get really proactive about it. But through that process of fertility preservation and coming out of a thing, is testing offered? So I guess it's are you freezing sperm knowing that there's sperm in there? You're not going to come back 10 years later and go, there's actually nothing here.
Yeah.
And secondly, what about when you've had your treatment or you're in remission and you're recovering? Is there testing offered then to see if your sperm has been affected, or are you kind of left to your own devices in that way to just kind of see how it pans out over the next few years?
So I think all of the above apply. I mean, certainly when anybody comes in to do fertility preservation, we would get to freeze, certainly the first sample, we'd freeze and we'd separate it into straws. And then the next day, we do what's called a test thaw. So that basically allows us to check the day after the sperm has been banked that that we're likely, if you've done a sample and it's been frozen into 8 straws, you would then thaw one and see the next day that actually when you thaw it out, it's working.
It survived.
So that gives the person confidence going away. But yeah, you're right. How do you know? And ultimately, the home testing kits, which ExSeed, use, is a great way to, without having to go and see a specialist and go into a clinic, you can do that very simply from home. And you can see what the sperm parameters look like. I mean, it's quite an ingenious invention to be able to use your smartphone and look at sperm without having to walk into a clinic or see your GP.
Yeah.
But equally, I wouldn't leave it too late. I think if you've had, it's the same with girls that maybe have conditions like endometriosis or polycystic ovaries. If you know you've had a cancer diagnosis and you're at the point of starting your family, I would always say to you, look into it early. Yeah. And either through home testing or through your local hospital. Unfortunately, hospital waits are quite prolonged at the moment. And so if you do have any, there are lots of great ways to get answers to this. And if you have any concerns, as far as I understand, you'd know probably more than I do about the ExSeed Health service, but you can get advice about what to do as well.
100%. And I think, you said something earlier that really struck me is about it being quite distressing to maybe go back into a clinic or even just a medical setting, like after you've had cancer treatment. I think if you've been going for, weekly radiotherapy or whatever it is, like the last thing you might want to do, 6 months later is go, right, now I'm going to go back and do sperm testing. You might really not want to do that, understandably, for a little bit. And I think that's where ExSeed is really helpful, because that home testing is you can do it in the comfort of your own home. You don't have to see anyone physically, but like you said, once you do the test, once you get the results, you get some tailored advice, and then it's sort of up to you how much contact you want with someone. You can, there's FAQs, obviously, you can do like live chat, or, one of our consultants will give you a phone call or a video call and you can really chat through your results. So I think you're right. I think it's a really quick, easy way to check. And, it doesn't test for everything. There's things like DNA fragmentation and stuff like that, you do often need to go to a specialist for. But I think it can be a really good marker just to say, okay, I've been through cancer, I've done this, but I've done my test, and there are still some guys swimming in there, and that can give you some hope for the future. And like you said, and if that doesn't work, then you have got your frozen one as a backup. So I think everyone would love to be able to conceive naturally if possible.
Of course.
Technology is incredible now, both from a testing and from a fertility treatment point of view, that if that's not working out for you, there's still so much hope out there. But I think getting to know what's going on with your body, from a cancer perspective, going back to our original conversation, it's like, know what's going on in your testicles, know what's going on with your sperm health. Knowledge really is power when it comes to your health and your fertility. Yeah. And so I think we just need more guys to get a bit more proactive about getting to know their bodies and getting comfortable with the conversations as well.
Yeah, absolutely. And we've come such a long way. The dark old days of just having one option, of wandering into maybe an andrology clinic to give a sample in. You've got to find a place to park in your NHS hospital, and then you've got to kind of, will you get a ticket if you put the right money in, and then you've got to find the place in the hospital, and then you've got to kind of go to a room, probably meet a receptionist who you won't want to say, well, actually, I've come to do my sperm sample, and whisper it across the table. So there are lots of barriers there to men maybe doing that. So yeah, I mean, the home kits are great. I think it's a really good place to start. And if there are any issues, go and see a specialist. And that's what, that's what the clinics are there for, to take on the work. It's not about one or the other, it's about the synergy between the two. And I think that's why, that's why I love chatting on here, because it's, it's about trying to get more people, as you say, aware of what they should be doing with their health, and monitoring it. Even if you haven't had a cancer diagnosis, you can be doing this and just being sure. There's nothing worse than leaving it too late. It's one of the hardest things I deal with when I see patients, is when they say, I wish I'd looked at this 5 years ago.
Totally. And like you said, I think that having a bit of information about yourself makes it, when you do, if you need to go and speak to specialists, you're a few steps into that journey. I think, like we said, if someone is trying to deal with a cancer diagnosis and a conversation on fertility, and you've never thought about these things before, and you've got no idea what's going on, it's just too much to take on. And I think you're trying to learn all these acronyms, and you're trying to learn all this biology, and it's a lot. Whereas I think if we can do it when we're being a bit proactive, and there's maybe not this sort of pressure on us, then if and when we do have to find ourselves in a fertility clinic, it won't be so daunting. I think it's just really getting comfortable with what's going on. So,
and there are lots of things that men do, being super healthy, super fit, playing lots of sports. It doesn't mean we're all Teflon coated. And actually, we've done a podcast on that this week on total fertility. Even it doesn't even affect you if you're a superhuman Olympian. It can affect any of us. And so it is just important to have that awareness, and to not leave it too late, I think. So, I think we're going to be talking to Morton, aren't we, your CEO, about sports and exercise and male fertility on our podcast, hopefully. In a few weeks' time. And I think that'll be really interesting as well, because I suppose a lot of patients I see as well, who think that they're doing the right things, sometimes from a sports and exercise point of view, they're actually doing things that can be harmful. So this is a completely different area. We're going off cancer now, but I think it's really important to have that awareness. I think that's what's really important here during this important week.
100%. I think and you mentioned sport, and I know I've used this analogy before, is if you like going to the gym, like you might be tracking your PBs, or what your weights you're picking up, or what your body fat index, or whatever it is. And it's like, maybe we need, it would be good if we could add sperm health and checking your testicles into those kind of little markers that we look for in our kind of physical health, and make it more of that sort of conversation. Well, look, Ed, thank you so much. Before we go, how can people, I guess we've talked about total fertility, you've mentioned the podcast. I know you recently had a male fertility kind of special, or one of your first episodes about that area, which was amazing. And you've got some more interesting ones coming up in the coming weeks, right?
Yes. So we launched the podcast in June. Total Fertility is a totally free website. It's a resource-rich website. You can find clinics across the UK, in Europe, and there's all sorts of things on there: information, prices, success rates, lots of things. It's not just about that. It's all about kind of giving people lots of information. It's written mostly by specialists across the UK, and the podcast comes out every 2 weeks, so twice a month on a Thursday. All the usual channels, Apple, Spotify. We've just finished, actually, I'm coming to the end of 3 episodes post the Olympics on sports and exercise, and then we'll be moving into sort of health awareness around specific conditions in the next sort of 6 months. So it's been fun to do, and I think the feedback's been great from patients that have listened.
Brilliant. So well, everyone can follow you. You can find out you're on Facebook. I know you're quite active on there as well, and check out the website. But Ed, thank you so much for spending some time with me today.
Connie, thank you.
And we'll speak soon. Bye bye.
Cheers. Bye bye.